We're going to talk about, and we have a lot, the opioid epidemic and how people get hooked on opioid pain medications, and one alternative that there may be to seek relief from your pain before you get to that point that you need a prescription.
9:43 back here on Morning Break. We've talked about this a lot, right, in the news. The opioid abuse crisis is real, and it is hitting closer and closer to home. Just last week, we told you about the increase in cases in Rowan County. Take a look at the numbers. In 2016, there were 292 calls where Narcan, that's the drug that's given to someone who has overdosed, was administered. And so far this year, 284 calls, and it is only August. Now, this video we're about to show you is a little disturbing, but it shocked us all. 2 people lifeless in the streets of downtown Salisbury after police say they had overdosed. And there was a 5-year-old child there. Now, thankfully, the man and the woman were saved, but that is not always the case. So this morning, we want to focus on prevention. What are some things we can do to stop the problem before it goes too far? And for that, I'm going to hand it over to you, Chris.
I'm here with Dr. Crystal this morning, and a lot of people, they do suffer from pain, and it may be legitimate when they go to a doctor and they get a prescription, but you're a chiropractor, and you're saying with neck and back pain, there may be things you can do to avoid going that route of painkillers.
That's right, Chris. In fact, low back pain is the number 3 reason that people will go to the medical doctor to seek care.
And I've had my lower back go out. I mean, it's debilitating. Your muscles go into spasms. I mean, it is painful, but I've also seen a chiropractor to kind of help relieve that.
Absolutely, and I'm going to share just a brief story of why I came into chiropractic. So I actually couldn't feel from my legs down to my feet. You could have shot me with a gun, I wouldn't have felt anything at the age of 23, and I was headed down that route, right? Mid-20s is about the time people start going to these types of prescriptions. And after just 3 sessions with a chiropractor, never having been, I was able to start to feel my feet and resume teaching. So that prompted me to go into school and share this story with you today.
What is it physically that happens when we start getting lower back pain or pain in our neck or between our shoulder blades? What do you call it? You say it's in an improperly aligned spine?
That's right. It's a misalignment, or in the chiropractic world, we just use the word subluxation. And essentially, you have to have pain felt in the brain first.
Okay.
So your central nervous system becomes involved. So if you feel the pain in your brain, then you start to experience the pain and stiffness that comes into the spine. And chiropractors are one of the only other healthcare providers out there, other than a neurosurgeon or a medical doctor, who can use a different type of treatment called an adjustment to help relieve that pain.
When do you see a patient that you tell them, I've done enough in terms of chiropractic, I think you actually need to go see a medical doctor or possibly a neurosurgeon?
Sure. So we actually integrate with the medical community well. We have guidelines that we follow, and according to the American Medical Association, their guidelines just changed to reduce the prescription of opioids and to try alternative therapy like chiropractic. When we receive the patient from them, all we do is we do a workup, an evaluation, a full exam, and if they're not improving within 2 to 4 weeks, then we send them back out to see if there's any other option.
But if it can prevent somebody from getting that first prescription and getting caught on pain pills, it may be a lifesaver.
And it's that spiral effect, exactly. That first prescription is coming from their medical doctor. They get every other medication from the pharmacy. It seems safe, but there is an alternative therapy that doesn't have the side effects. Remember, chiropractic care doesn't make you groggy, doesn't cause foggy brain, doesn't make you not able to operate a vehicle, which some of these medications do have.
You've got a couple of examples for us this morning. Where do you want to start with those?
Yes, so I'm going to show you how to ease back pain on your own, and it will help with the chiropractic adjustment. So if you want to lay face up.
All right.
Yes, Chris, you're going to be the guinea pig. Here we go. So we have to be careful,
right? I've got
right?
2 big pains in the neck.
I'll get you taken care of in a minute. So the biggest thing with low back pain is you want to avoid any type of sit-up or crunch. So if that's in your exercise routine and you do have low back pain, stop immediately. One of the stretches you can do first thing in the morning is just slightly bending your knee in towards your chest like this and holding it for about 30 seconds. Then from there, you can put it straight on the ground and just press down through your heel. You'll lift your lower back, that's perfect. Again, 30 seconds and relax. So then you do the same exact thing to the other side. Even if your pain is one-sided, you still want to do both. You're treating the mechanical pain. Okay, so 30 seconds, put the foot down, and
then
hold
what?
for 30 seconds. Exactly.
Okay.
So then,
And how many sets should you do with that?
sure. So I want you to do 5 on each leg in the
Okay.
beginning. And then after your exam, we could tell you and curtail it specific to what's going on and causing your pain.
What is it about the crunches that are
crunches?
that are bad for you?
So I'm going to move over to the spine. So essentially, when you crunch like this, you're taking these nerves that are in between the discs here, and you can see as you bend your bone, you're allowing that disc to slip backwards and
Okay.
put pressure on the nerve. And that nerve is what sends that pain to your low back and
So-
down to your other organs.
That's where it's pinching. There we go.
Sorry.
You're fine.
Okay, so that's where it's pinching, exactly. And it can cause other things, low back pain, pain and numbness in the legs. This is your lumbar spine down here. And then head pain and headaches comes from your upper part of the neck.
Dr. Harrison, thank you so much.
Thank you.
Great information.
Appreciate it. Thank you so
My
much,
back
Chris.
feels better already.
Good.
We'll take a break. Be right back.